Yes,
Yes, please.
Dr. Md Shafiqul Islam, are you ready for your presentation? Dr. Yusuf can.
I'm ready. I'm ready, sir.
Okay. Then Shafiq will start, and later on Yusuf will come. Share your screen.
Full screen, please. Huh?
Okay, full screen.
Nice.
Thank you, Dr. Tariq Reza Ali, sir. Honorable Chairperson of today's virtual scientific seminar, Professor Dr. Sharfuddin, sir, and Professor Parthobishar, sir, other faculties from Bangladesh and India, and all other participants, very good afternoon. I'll talk on screening of diabetic retinopathy in southern part of Bangladesh, that is Borishal division, and what is our observations. There is one of the major cause of blindness worldwide, and early diagnosis and management is very important to prevent the blindness from deer. This is the location of Borishal division. Is located in the southern part, away from the Dhaka, and is side of Bay of Bengal. There's a lot of river in Borishal divisions. And previously, we have no center for deer service. Unfortunately, considering this fact, a NGO, Australian NGO, Federalist Foundation, came forward, and with the help of them, we established a deer project and screened the patients. They extend our existing health system and link with the non-government hospital, non-government association, that is Diabetic Association of Bangladesh. All of you know, Diabetic Association, most of the diabetic people of Bangladesh are registered there. So we target Diabetic Association. So is the bottom is the Union Health Bujala Health Complex, that is sub-district level. There is no ophthalmologist, but we train the nurses. They can capture the picture with the portable fundus camera. Then they refer the, if need, they refer the patient to the Sadar Hospital. District level. In district level, there is the ophthalmologist as well as the high resolution camera. And also, they can also refer to the divisional hospital, that is Sher Bangla Medical College Hospital, where I are working. But we have very strong horizontal referral system from the non-government hospital, that is Diabetic Association of Bangladesh Hospital. So most of, as this is the patient bank, so we target them. This is the project area. Out of 6 districts, our project is the 3 districts only. In every district, on government hospital and on the Diabetic Association Hospital also included. So basically, what Federalist Foundation done for us, manpower development or research development, logistic and instrumental supports, development of deer centers, especially IT support, record keeping. They record manually as well as in the computer. But when they focus mainly on also in the big role in the social awareness, Gombira social program, folk song, many way they raises this thing. So initially, with the help of the deer, we done a study, a survey in the Borishal division, in all 6 districts, 32 sites. Diabetic retinopathy prevalence was 18%. So if we go through the variables, we retrospectively review all the records. We scanned 3,299 patients with these 3 years. And all the variables we documented and recorded, especially socio-demographical, clinical, as well as the biochemical, all the variables we recorded. Prevalence of deer in the southern part in my hospital is 32%. And if we see this, the severe NPDR and vision-threatening PDR at leader plus is 7 plus 3, most total 10%. If we go some of the other variables, there is no difference between main age group between 2 deer and non-deer group. BMI is slightly lower in deer group, and duration of DM is significantly higher in the deer group, and the blood sugar is also significantly higher in deer group, and the vision is poor in the deer group. Though there is no mean difference, but when we do the age grouping, we find more patients from the 4th, 5th, and decade, and maximum from the 5th decade. Male patients suffer more in our study, our findings. People from the low illiterate and low education people also suffer more. Patients, those who were registered to the DAB center, as they visited regularly, so they found less deer. But those who are not registered, they are more prone to develop the deer. Patients who are severely diabetic, receiving on insulin, they are more deer. Unemployed or jobless people suffer more from the diabetic retinopathy. These are the regression models showing the age, male sex, duration of DM, and blood sugar, BMI, or insulin. These are all the risk factors. This is the other comparison with the other studies regarding the BMI. So some of the limitation of our project or our studies, it is a hospital-based study. It may not reflect the original scenario in the community, but sample size is good, more than 3,000. But some of the data is incomplete, so we cannot comment about the serum creatinine level or lipid profile or HbA1c. So last of all, we can tell DR is highly prevalent in Bangladesh as well as the southern part of Bangladesh. So we have to regular checkup, good blood sugar control, health education, social awareness, all are the very important for prevention of the blindness from the DR. This is my hospital, one of the biggest hospital of Bangladesh. 50 years we have anniversary, and our Professor Sharpidin sir also from this medical college hospital. These are some of the activities. These are the visitors from the Fellows Foundation from the Australia, Google peoples, also from the Nepal and Kenyans people also visited our center. They are happy our performance seeing. And this is the royal guest from the royal family of the UK and the British High Commissioner. This is our ADD sir and sir. This is the remark from our British High Commissioner. Thank you very much for giving me the opportunity to deliver my speech.
Thank you, Dr. Shafiqul Islam, for your nice presentation. Any comment from our panelists that